Live. Okay. Hi, everyone. Dr. Adriana Popescu here with you today, talking a little bit about PTSD. Today is actually PTSD Awareness Day. The whole month has been PTSD Awareness Month, and today is World PTSD Awareness Day. So I thought I would talk a little bit about that. My colleague Nicole Collins had a Facebook Live a couple weeks ago where she talked about what is PTSD, how do I know if I have it. And now I wanted to take a different aspect of it, which is to look at what is PTSD treatment and what actually works. I'm somebody who's a licensed clinical psychologist and an addiction and trauma specialist. I've been working with trauma specifically for over 25 years now, because pretty much everybody who comes to therapy has some sort of trauma of some kind that has had an impact on their life. I think all of us in general have experienced some form of trauma. Just being here, being alive, living on planet Earth sometimes can feel traumatic. And, we have our more overt sort of big T traumas that are the more obvious things like wars and natural disasters and assaults and things like that, life-threatening illnesses, accidents, things like that. But we also have those more covert or little t traumas, which are the day-to-day things we go through, like being harassed or bullied, loss of a friendship, loss of a relationship, loss of a job, a pet, different things we can live with. Maybe living in a place where, or with certain spiritual or religious beliefs that don't honor who you are, your gender, your race, your identity, whatever it might be. Lots of different ways in which trauma shows up. But what I really want to talk about is the treatment aspect of it. So, healing from trauma on your own can be pretty difficult because of the way the trauma impacts your body and your brain. And because there are things that you might not be aware of, like when you repress a trauma, when you don't actually, when you're unable to deal with it in the moment, when it happens, it's like you take all that material, all the emotions, all the energy around that trauma, and you shove it away. Experts in trauma treatment like Peter Levine and Besser van der Kolk call this the trauma capsule. It's almost like we shove all this stuff in there. I can't deal with this. It's too overwhelming. And we put it in the trauma capsule, and then we call that repression, right? And we think, okay, that's fine. Now I move on with my life. Except what's in that trauma capsule is still impacting you. You don't really get away from it. And it can show up in all these different ways that Nicole talked about on her video, but it can show up as, like, for example, trauma responses, having an exaggerated startle response, like when someone comes up behind you and you jump out of your skin, or you're constantly hyper vigilant on the lookout for danger and seeing danger where there might not be any. So when we talk about healing from trauma, we have to talk about it in phases. Okay. There are 4 kind of known phases of trauma treatment. And the first one is acknowledgement, right? First, you have to acknowledge that this experience has happened and that it has impacted you in some ways. Not everybody who goes through a potentially adverse experience is necessarily going to have lingering trauma effects. But the first thing is to look at is, am I somebody with what I went through, that car accident, that loss, that somebody passing away, whatever it was, am I still being impacted by it in some way? And that's where you're looking for things like trauma responses. You might find yourself also shutting down. You might feel like emotionally numb. You might have a hard time being around people or trusting people, especially if your trauma had something to do with another person. You might not feel safe, and that's a big one. So that's the second phase of trauma treatment. First, we have to acknowledge what happened, and we have to acknowledge the effect that it has had on us, whatever that is. A lot of my clients, struggle with addictions. And when we look at underlying root causes of those addictions, oftentimes we find unresolved trauma. So first, we have to acknowledge it and admit that it's there and that it's still impacting us because there's something about it that is unfinished, unresolved. Next, we have to create safety. All right. Safety means a lot of different things. It might mean safety in your environment. If, for example, you're in an abusive relationship with someone, it might mean looking at ending that relationship or getting away from an abusive person, cutting certain people out of your life, perhaps. So there's, external safety, right? Maybe you live in an unsafe neighborhood and it's time to look at living somewhere else. And then internal safety, that's the harder one. How do we create a sense of safety in our bodies? Okay. This is where I think the limitations, this phase and the next one, which is processing trauma, this is where I think traditional talk therapy falls short, because when you are in an active trauma response, when your brain, your amygdala, is basically telling you there's a life or death situation happening, we're literally at risk of dying right now. When that mechanism gets activated in situations where there really isn't a life threatening risk, and unfortunately, people with trauma tend to have overactive amygdalas that are constantly telling them there's danger where there isn't. So they're getting panic and anxiety and these stress responses. In order to create safety, you have to be able to downregulate that mechanism. You have to get the amygdala to stop firing as if you're in a life or death situation. And talk therapy isn't going to do it, because talk therapy is only focusing on this part of your brain, your logical human, the part of the brain I'm speaking from right now, right? Your rational mind, your prefrontal cortex, the part of your brain that evolved most recently that humans have. Okay. This fight, flight, freeze response is much more primitive parts of your brain. It's your reptilian or lizard brain, it's your mammalian brain. Um, when this happens, when a fight flight thing gets activated, or freeze, fight or flight and freeze, they look a little different. But when this response gets activated, you actually have no control over which way you go. Your brain will either go to fight or flight, where everything gets amped up, revved up, and you're getting ready to run away from the threat or fight the threat. And freeze is when everything shuts down and you play dead, hoping that the predator or threat will leave you alone. Okay. We don't have control over that. Talk therapy doesn't have control over that. So when we get into that activated state where your heart is racing and the stress hormones are pumping, or everything is starting to shut down and you're getting dissociated, numb, or checked out, we need different tools. We need grounding tools, super basic things like 5 senses, like name 5 things you can touch. Name 4 square things on the wall you can see. Name 3 things you can hear, sounds you can hear. 5 senses, things you can touch, smell, taste, touch, feel, see, hear, all the senses. Okay, you got to go through those. That's a helpful grounding technique. Breathing is super helpful. I teach a lot about things like box breathing, a 4 square, which is also known as 4 square breathing, where you breathe in for the count of 4 and you hold your breath for 4, and then you exhale for 4 and then hold your breath for 4 again. Okay, that's super helpful. 4-7-8 breath, all different kinds of breathing techniques. These are essentially polyvagal exercises. They help get that amygdala, they help get a signal up to your amygdala to help calm the nervous system down and help the body to feel safe. So this is about creating a sense of safety in the body. EFT tapping is really great for it. There's many other energy psychology techniques. I interviewed a lady named Erica Neal on the podcast. I have a podcast called Kaleidoscope of Possibilities, and she told us about havening, right? Which is this like very soothing movements that you do, much as you might comfort a child, right? You might do this to their face. You do these things and it helps calm your nervous system. Heart math has certain kinds of breathing techniques, breathing through your heart. There's cold water is a really powerful one. You can like splash cold water on your face or hold ice cubes in your hand. All of these things are polyvagal exercises designed to activate the vagus nerve, which is part of this whole fight, flight, freeze mechanism, to activate that nerve to get out of the fight, flight response and into a more parasympathetic nervous system state of calm. So back to phases of trauma healing. First, acknowledgement, then creating safety. Then we have to do the processing. Okay. And I say to my clients, I know this is the hardest part. And they have a lot of fear around it because, look, I put that stuff away. I repressed it because I couldn't deal with it. It felt overwhelming to me. Why do I want to go and do that now? Except in my experience, the only way I've seen personally and professionally, the only way I've seen people really heal from trauma is to go through it. In other words, to actually allow yourself to access what got in that trauma capsule and feel the feelings, cry the tears, whatever it is that needs to happen, remember the memories until you can release all of that trauma energy that is connected to the memory, right? So the fear, the anger, the sense of powerlessness, whatever got locked in the body, right? The different stress responses that are locked in the body. And you can do that in a variety of ways, right? I'm obviously partial to brain spotting, which comes from EMDR. I also use EFT tapping and other energy psychology techniques to get to these energies and be able to process and release them. NET neuroemotional technique is really good for this. Somatic experiencing is a well known trauma healing technique that was developed by Peter Levine. Sensory motor processing and therapy. There's a lot of different somatic, a lot of energy based, Reiki, access consciousness bars, and body processes. There's all kinds of different modalities we can use to process that trauma, to release this stress, energy, and emotions from the body, and then to move us toward the last phase of treatment, which is integration. That's more sort of the mental, back to your prefrontal cortex. There's some element of cognitive understanding. How do I make sense of my experience? How can I go from feeling like a victim, like somebody who's powerless over the things that happen to them? How can I move from victim consciousness into a state of empowerment, into a state of post traumatic growth, where I can look back on my experience and say, yeah, that was really awful, but I survived and I'm stronger now. And it gives my life a different purpose now. And maybe I can help other people with this. That's post traumatic growth. We can do that at the integration stage. But first, we have to do the processing. And I don't find that talking about trauma in the traditional talk therapy sense helps with the processing. It can help with the integration piece. And there is a modality called CBT, cognitive processing therapy, I believe, which is a cognitive behavioral therapy technique that is designed to work with people kind of post trauma to try to make sense of the experience and maybe challenge and release the beliefs that would have come from it, like I have no control over what happens to me, or maybe I was a bad person, I'm a bad person, I deserved it, or I'm damaged goods now. All these like really distorted, what I would call core false beliefs that can emerge from having a traumatic experience or a series of them. So, 4 phases for healing through trauma. And the reality is, I fully believe that we can heal this. I don't ascribe to this idea that because maybe you got a diagnosis of PTSD or post traumatic stress disorder that you're then going to be stuck with this label for the rest of your life, that you're going to be stuck with this disease that you're never going to be able to cure. I mean, those of you that know me a little bit know my story. I was given those diagnoses. I was told with Lyme disease and chronic fatigue syndrome, I'll never heal from that stuff. Best I can do is manage my symptoms. That tends to be the Western paradigm, like learn how to manage your symptoms. And I'm of the mindset of no, I actually want to get to the root of what is creating this issue and heal it at the root level. And I don't have to be stuck with Lyme disease or PTSD or whatever it is anymore. I've had experiences that I've, shared before about traumas that happened earlier in my life, a series of car accidents, being attacked by a hive of bees, and I had lingering trauma effects from all of that. There was pain in my body. There were phobias I developed of insects. There were, different things that came from early life traumas. Witnessing like what happened with my parents when they divorced made me not want to trust people and not want to be in a relationship. All those things with the tools that I've learned, these more holistic tools that really look at mind, body, spirit, and emotions. And we treat all the aspects of the traumatic experiences from those different perspectives. What I found was I was able to heal myself of the trauma. I don't have trauma responses anymore. We've extinguished those. I do feel safe enough to open my heart and trust people, and be in relationships with people. All of those things have changed for me, and of course, with the thousands of people I've worked with over the last 20 some years, I've seen miracles for them as well. So this is, where, and what I wanted to say to professionals, working with trauma is really a specialty. You know how, like, you go to med school and you could be a general like doctor or internal medicine doctor, and you kind of practice all different kinds of, you deal with all kinds of different issues. I think as a general therapist, you get that training, but to do trauma work, it's a specialty. Um, it's like, being an orthopedic surgeon, like, that's a specialty. Uh, those of us that treat trauma really, I think, need to be educated and get continuing education in specific modalities that are evidence based. Everything I've been talking about is pretty much evidence based, or is very close to being deemed that. It's evidence based, meaning that research backs it, science can explain how it works. We have that now with these techniques. And I think we're doing our clients a disservice if we're still relying on traditional talk therapy to help people heal from trauma. Because the reality is, talking about your trauma over and over again doesn't actually help you to heal it. You got to get down deeper. You got to get to the roots. You got to get to the body stuff. You got to process what's been repressed in there. You got to be able to release that energy of trauma. And then the memories can exist with all, it's called memory reconsolidation. The memory of the painful experience can be remembered without all the pain, right? You can still remember that it did feel really bad at one point, but you don't continue to re-experience it, because the thing about PTSD is you're continuing to re-experience the trauma over and over again through flashbacks, through nightmares, through intrusive memories, through wanting to avoid anything that reminds you of that experience. That numbing, that shutting down, being stuck in the fight or flight or freeze state. All of those things are lingering trauma effects that talking about alone doesn't really help people get through. The other really cool thing about some of these somatic and holistic based approaches is they work a lot faster than some of the more traditional techniques. And I think they create really amazing, permanent, and lasting results. So obviously, I'm biased. Take it with a grain of salt. But if you want to find out more, I really think that my trauma healing program, Firebird Healing, we really see that as just like a cornucopia of information. We have lots of articles and videos and resources. And on our social media, on YouTube and Facebook and LinkedIn and Instagram, we're always putting educational material out there about trauma, about PTSD, about addiction, because that's the things that we specialize in. And we want people to know, both our fellow healing professionals and people who might be struggling with these things, or maybe you're the loved one of someone who struggles with these things. We want to get the message across that people can heal from these things. I mean, the whole tagline of my business is triumph over trauma, and Firebird, the bird that rises from the ashes. So it is possible to heal. We know what works. Science is now backing us up, and the research is confirming what we clinicians have known for a while now. These holistic techniques do work. Get trained in them if you're somebody who wants to work with trauma, or refer to this specialist like myself who know how to work with it. If you're trying to heal from trauma on your own, just get over it and move on isn't going to work because of the way that trauma impacts your body. Okay. So this is what I wanted to get the message across. If you guys have any questions, please feel free to reach out to me. You can always DM me through the social media channels. You can find me on my website, firebird-healing.com. You can leave comments here in the different platforms we're live streaming on. I'm happy to give you whatever information I can and to steer you in a particular direction if you're wanting some support or guidance around how to do this. I did a workshop recently that was really cool. We started as a 4-part workshop, then we added a part 2 and did 4 more weeks, called From Survival to Thrival. I will be offering that workshop again in the future. If you're interested, you can get on a wait list for that. And right now that group has evolved into an ongoing weekly group. We just had our first group last night. I'm really excited about that. We actually have room for 1 or 2 more people with the trauma from survival to thrival group, which is just a group of people who have done some work on themselves, are still in that process of healing from their trauma. But it's a weekly support group that we've created to offer them a place where they can be with other folks that are struggling with similar things. And I thought our meeting last night went really great. So I'm super excited about that. We're going to keep adding more and more offerings at Firebird. You know, we love doing workshops. We really want to do some healing retreats. We have one for Bali that we had to postpone this year that we're going to do next year, but maybe we'll look for something a little more local that might be approachable. And oh, this is a lovely comment from Ruth. I'm so grateful for you, Adriana, and all the tools. I feel like a whole new person, and now I can support other people going through similar experiences without all my trauma. Thank you, Ruth, for sharing that. That is a beautiful example of someone who's in the stage of post-traumatic growth, you know, who's been able to look at some of the things she's been through and see the positives in it. So I'm super grateful. Thank you for that comment. And feel free, anyone else, you know, who's had that experience where you've been able to heal from a trauma. If you want to share a little bit about your experience, we'd love to hear about it. So thanks everyone for tuning in. I think I've said all I wanted to say for now. Feel free to reach out if you want to find out more. And I'll be back again in a couple weeks with another Firebird Live. And follow me on all the social media and all the things. And oh, one last thing. We're doing a book launch this Saturday. My book, What If You're Not as Effed Up as You Think You Are? I have a whole chapter in that book devoted to trauma and the impact of trauma. And I talk a lot about the different healing modalities that I mentioned today. This book was released in paperback at the end of last year, and we're finally getting the ebook out. Is coming this Saturday, July 1st at all day. We're going to be having the book on special offer. We had to price it at $2.99. Sorry, we thought we could do it a little less, but with Amazon and whatever, $2.99. You can get the ebook that day, and we're trying to make it an Amazon bestseller. So if you're able to get the book, particularly between the window of 9 a.m. Pacific to noon Pacific, we're going to be going live here again on all these platforms and on Wholehearted's, that's my publisher's YouTube channel. We're going to be going live airing this talk that I did. It's about a 45-minute talk that I did in front of a live audience about the book with live Q&A happening afterwards. So you can also catch me this Saturday, and would love to have your support on getting the book out there to more people, getting all those Amazon algorithms going. So, because reviews help. I know when you're asked to write a review, you're like, ugh, I don't feel like doing that. All you have to do is write a few words. You can even just do like the star ratings, but honest reviews on Amazon is what helps the book get seen by more people. So I will ask you guys to help contribute to that, especially if you do support the work that I'm doing, if you support these techniques, if you yourself have found these techniques to be helpful for you. I would love to hear more about that. And let's let the world know. All right. Let's get these tools out there in the hands of more people who need them, because there's a tremendous amount of suffering. There's a tremendous amount of trauma on this planet right now. And I would like to be part of changing that and helping people triumph over their trauma. So on that final note, I will leave you. Thanks for tuning in.